In the battle against rheumatoid arthritis, two contenders step into the ring: Methotrexate and Remicade. These two treatment options have become heavyweight champions in the fight against this chronic inflammatory disease. But which one delivers the knockout blow? Understanding Methotrexate and Remicade. Methotrexate, a traditional disease-modifying antirheumatic drug, DMARD, has been the long-standing go-to for rheumatoid arthritis treatment. It is an immunosuppressive medication that works by inhibiting the production of certain cells in the immune system, thus reducing inflammation and preventing joint damage. Methotrexate is typically taken orally or administered through injections, and it is often the first-line treatment prescribed for rheumatoid arthritis. Remicade, on the other hand, is a newer biologic DMARD that has gained popularity for its targeted approach to stopping the progression of rheumatoid arthritis. It belongs to a class of drugs called tumor necrosis factor (TNF) inhibitors, which work by blocking a protein called TNF-alpha that plays a key role in causing inflammation in the joints. Remicade is administered intravenously, usually in a healthcare setting, and is typically used when other treatments, including methotrexate, have not provided sufficient relief. How methotrexate works for rheumatoid arthritis. Methotrexate works by inhibiting the activity of an enzyme called dihydrofolate reductase, which is involved in the production of DNA and RNA. By interfering with this process, methotrexate reduces the production of certain cells in the immune system, including T cells, B cells, and certain types of white blood cells. This helps to dampen the immune response and reduce inflammation in the joints, which are hallmarks of rheumatoid arthritis. One of the key advantages of methotrexate is its ability to slow down joint damage and prevent long-term disability in patients with rheumatoid arthritis. Studies have shown that methotrexate can effectively reduce pain, improve joint function, and decrease the need for other medications, such as corticosteroids. Additionally, it has a relatively low cost compared to some of the newer biologic DMARDs, making it a more affordable option for many patients. However, methotrexate is not without its drawbacks. It can cause a range of side effects, including nausea, vomiting, diarrhea, and hair loss. Some patients may also experience liver toxicity, which requires regular monitoring of liver function. Methotrexate is also contraindicated in pregnant women due to the risk of birth defects. Despite these potential side effects, methotrexate remains a widely prescribed and effective treatment option for rheumatoid arthritis. How Remicade works for rheumatoid arthritis. Unlike methotrexate, Remicade targets a specific protein called tumor necrosis factor alpha, TNF-alpha. TNF-alpha is a cytokine that plays a central role in the inflammation associated with rheumatoid arthritis. By blocking TNF-alpha, Remicade helps to reduce inflammation, relieve pain, and slow down joint damage in patients with rheumatoid arthritis. One of the advantages of Remicade is its ability to provide rapid and significant relief from symptoms. Many patients experience noticeable improvements in pain and joint function within weeks of starting treatment. Remicade is also effective in reducing the signs and symptoms of other autoimmune conditions, such as psoriasis and Crohn's disease, which often coexist with rheumatoid arthritis. However, Remicade is a more expensive treatment option compared to methotrexate. It requires regular intravenous infusions, typically administered every 8 weeks, and these infusions need to be done in a healthcare setting. This can be inconvenient for some patients and may involve additional costs. Additionally, like other biologic DMARDs, Remicade can increase the risk of infections, including serious bacterial, fungal, and viral infections. Therefore, patients taking Remicade need to be closely monitored for signs of infection and may need to temporarily discontinue treatment if an infection occurs. Pros and cons of methotrexate for rheumatoid arthritis. Methotrexate has several advantages that make it a popular choice for rheumatoid arthritis treatment. Firstly, it is effective in reducing pain, improving joint function, and slowing down joint damage. It is also relatively affordable compared to some of the newer biologic DMARDs, making it more accessible for patients. Moreover, methotrexate can be used as a monotherapy or in combination with other medications, providing flexibility in treatment options. However, methotrexate is not without its downsides. It can cause gastrointestinal side effects, such as nausea, vomiting, and diarrhea, which can be bothersome for some patients. It may also lead to liver toxicity, although this is rare when used in appropriate doses and with regular monitoring. Additionally, methotrexate is contraindicated in pregnant women due to the risk of birth defects, so women of childbearing age need to use contraception while taking this medication. Pros and cons of Remicade for rheumatoid arthritis. Remicade offers several advantages for patients with rheumatoid arthritis. It provides rapid and significant relief from symptoms, improving pain and joint function within weeks. It is also effective in treating other autoimmune conditions that often coexist with rheumatoid arthritis. Additionally, Remicade can be used in patients who have not responded adequately to methotrexate or other conventional DMARDs. However, Remicade has some drawbacks. It is a more expensive treatment option, and the need for regular intravenous infusions can be inconvenient for some patients. The risk of infections, including serious ones, is also a concern with Remicade, and patients need to be closely monitored. Furthermore, like other biologic DMARDs, Remicade may increase the risk of certain types of cancer, although the overall risk is considered low. Methotrexate versus Remicade, a comparison of effectiveness. When comparing the effectiveness of methotrexate and Remicade, studies have shown that both medications can significantly reduce the signs and symptoms of rheumatoid arthritis. However, Remicade appears to be more effective in achieving remission and slowing down joint damage compared to methotrexate alone. In fact, a study published in the New England Journal of Medicine found that Remicade, in combination with methotrexate, was more effective in inducing remission and improving physical function compared to methotrexate alone. It is important to note that the choice between methotrexate and Remicade will depend on various factors, including the severity of the disease, the presence of other medical conditions, and individual patient preferences. Some patients may respond well to methotrexate alone, while others may require the targeted action of Remicade to achieve optimal results. In some cases, a combination of both medications may be recommended for maximum benefit. Methotrexate versus Remicade, a comparison of side effects. Both methotrexate and Remicade can cause side effects, although the specific side effects may differ. Methotrexate is known to cause gastrointestinal symptoms, such as nausea, vomiting, and diarrhea. It may also lead to liver toxicity, although this is rare when used appropriately and with regular monitoring. Additionally, methotrexate is contraindicated in pregnant women due to the risk of birth defects. Remicade, on the other hand, carries a higher risk of infections compared to methotrexate. Serious bacterial, fungal, and viral infections can occur, and patients need to be closely monitored for signs of infection. Other potential side effects of Remicade include infusion reactions, such as fever, chills, and rash, as well as an increased risk of certain types of cancer, although this risk is considered low. Choosing the right treatment option for rheumatoid arthritis. Choosing the right treatment option for rheumatoid arthritis requires careful consideration of various factors. The decision should be made in consultation with a healthcare professional who can evaluate the specific needs and circumstances of each patient. Factors to consider include the severity of the disease, the presence of other medical conditions, the cost and convenience of the treatment, and the potential side effects. For many patients, methotrexate may be a suitable first-line treatment, offering an effective and affordable option. It can be used as a monotherapy or in combination with other medications, providing flexibility in treatment choices. Remicade, on the other hand, may be considered for patients who have not responded adequately to methotrexate or other conventional DMARDs, or for those with more severe disease activity. Ultimately, the goal of treatment is to achieve remission, reduce pain and inflammation, preserve joint function, and improve overall quality of life. The choice between methotrexate and Remicade will depend on individual patient factors and preferences, and it may require a trial-and-error approach to find the most effective and well-tolerated treatment. Conclusion: finding relief with methotrexate or Remicade. In the battle against rheumatoid arthritis, methotrexate and Remicade have proven to be formidable contenders. Methotrexate, the long-standing champion, offers an effective and affordable option for many patients. It can slow down joint damage, improve joint function, and reduce the need for other medications. Remicade, the newer biologic DMARD, provides targeted relief and rapid symptom improvement, especially for patients who have not responded adequately to other treatments. While both treatments have their pros and cons, the choice between methotrexate and Remicade should be made in consultation with a healthcare professional. The decision should consider the specific needs and circumstances of each patient, including the severity of the disease, the presence of other medical conditions, the cost and convenience of treatment, and the potential side effects. In the ring of rheumatoid arthritis treatment, methotrexate and Remicade may be the contenders, but the ultimate victory lies in finding the right treatment approach that provides relief, preserves joint function, and improves quality of life. With the guidance of healthcare professionals and ongoing research advancements, patients can continue to fight back against rheumatoid arthritis and reclaim their lives. The battle may be tough, but the knockout blow is within reach.